I'm a fellowship-trained breast surgical oncologist. I'm Dr. Amani Jambekar, and let's talk about the oncotype score and when it should be ordered. The oncotype score is a score that's used for estrogen and progesterone receptor positive breast cancers to predict what is the likelihood the cancer can come back somewhere else in the body over the next 9 years, and would there be a benefit to doing chemotherapy. This is an example of a high oncotype score. This patient has a 20% risk of distant recurrence, or the chance the cancer will come back somewhere else in the body over the next 9 years, and a greater than 15% absolute chemotherapy benefit, which means this patient should certainly consider chemotherapy. Generally, the oncotype score gets used for patients after they've already had surgery, but sometimes we do order it for patients before surgery, especially when knowing that answer will make a difference in what kind of surgery they could potentially have. For example, if a patient has a larger breast cancer like this, it may be worth sending an oncotype test before surgery and figuring out if this patient would be a good candidate to take chemotherapy before surgery. If we do know that they would benefit from chemotherapy, giving it before surgery may cause this tumor to shrink down, and then this patient could be eligible for a lumpectomy rather than a mastectomy. So when the oncotype score might change the surgical management, it's a good idea to order it before surgery. In general, those patients with estrogen and progesterone receptor positive breast cancers, especially those which are smaller than 2 centimeters, end up getting this score done after surgery because the timing of chemotherapy doesn't seem to make a big difference. It could be given before or after surgery for patients who have this type of cancer. But it is something you should discuss with your medical oncologist at your first consultation before you have surgery. Some patients want to know all of the information before they decide on surgery, and some patients, if they knew that they would need chemo, would choose to get chemo first. So I think that we're going to see a trend where more and more people are ordering oncotype before surgery rather than after.